good afternoon, everybody again, and welcome to today's webinar on the timely topic of sun safety and UV awareness, which has been organized to mark the start of European Week Against Cancer, and is also part of a webinar series which focuses on different messages within the European Code Against Cancer. My name is Ginevra. I am a communications officer at the Association of European Cancer Leagues, ECL, and I will be your host and moderator for the next hour and 50 minutes. Today's webinar is co-hosted with EUROSKIN, and I am utterly delighted to be having here with us today Dr. Rüdiger Greinert, who is the Secretary General of EUROSKIN, Dr. Emily Van Deventer, who is the Head of Radiation and the Health Unit at the WHO in Geneva. I also have with me my colleague, Dr. Wendy Yared, ECL's Director, as well as Anna Maria Petrica, who is a junior doctor and one of our youth ambassadors for the European Code Against Cancer for Romania. And I hope you are prepared and excited to learn more about skin cancers, tanning equipment, sun safety practices, and policy responses as much as I am today. And just quickly in terms of the agenda, I'll go over a few housekeeping items right now. And after that, ECL Director Wendy Yared will say a few words about European Week Against Cancer, as well as the work that European Cancer Leagues have been done on sun safety. Then we'll have Anna Maria giving a brief overview of the European Code Against Cancer and our Youth Ambassadors program. Then Dr. Greinert will present for about 20 minutes before taking some questions. And finally, we'll have Dr. Van Deventer presenting for about 50 minutes, and she will also take some questions before wrapping up with a short quiz and poll to test your memory. And we will have finally some concluding remarks from my colleague, David Ritchie, who is the Cancer Prevention Manager at ECL. So just a few housekeeping items. If your connection is poor, if you're not hearing properly, if you're not seeing properly, you have an options to switch to your phone audio, and you can switch back in between your phone and computer audio if that's you're experiencing that kind of problem. As I said before, you'll be able to ask questions in between after each keynote speaker's presentation. And in order to do so, you can use the chat function. You can hover over your screen at the bottom, you'll see the chat function on the left-hand side. Just make sure that your questions are being addressed to all panelists and attendees so that everyone can see it. And after the webinar, we'll send you a thank you email with the recording of the webinar, the slides, as well as a short feedback survey. So please take a minute to give us some feedback. And yes, without further ado, I just hand over to ECL Director Wendy Yared.
Thank you very much, Gina, and welcome to everyone to this webinar. I also would like to thank our experts, our speakers online here with us. So just a few words about the European Week Against Cancer. We're in the first day now of the European Week Against Cancer. So this runs from 25th to the 31st of May each year. And the Week Against Cancer was developed and led by ECL during the first Cancer Joint Action that was co-funded by the European Commission. And that was in 2011, so this is now almost 10 years ago. That was the European Partnership Action on Cancer. So we're now in the third joint action on cancer, which is the Innovative Partnership Action Against Cancer. And there we're also helping in the prevention work package. Now, the aim of the European Week Against Cancer is to give wider visibility and attention to the prevention messages. So we're talking about primary and secondary prevention messages in the European Code Against Cancer, where, of course, UV and sun safety is a key message. And we will outline that later. So now, regarding our work, what the ECL has been doing on UV and sun safety, these are just some highlights of what we've been doing. They've been really successful, but only because of the excellent organizations and experts that we work with as partners. So we generally target policymakers at both the European and national levels with publications such as the one you see here, regarding what the different cancer societies have done against sunbed use. So that's a very interesting article in terms of what they have done, how they have targeted their own policymakers in their own countries. And the idea is to give other organizations, other countries, on how to target the policymakers to achieve the achievements that they have made. We provided sun safety recommendations, and this is now recently updated, and that was in partnership with all cancer societies. So if you look at these messages, they're really relevant no matter where you are in Europe. And even though it was quite a joint effort, because of course, you know, if you're living in the south or versus living in the north, it's not always easy to agree what hours we should avoid being in the sun. So, but that's and these are downloadable on our website. We have also worked in the area of occupational skin cancer, and here we were having meetings at the European Parliament with the MEPs against cancer to make sure that they were aware of the issues and to help us vote for directives and recommendations in favor of protecting workers when they are exposed, who work mainly under the sun. So we work with other partners. So for that meeting, we worked with the ADV and ETUY, but of course, we also organized policy meetings in the past with EUROSKIN, and we also worked with Greinert International to target the more general public for UV safety messages, because of course we work with our cancer societies to target the different, prevention messages for the general public and patients. But by working with Greinert, we're also targeting a target population that we normally may not have access to. So we're very grateful for that, because they also give us an restricted operating grant. So again, all this information, everything is downloadable off our website. So please do visit it and feel free to use the materials. And if you have any questions or any recommendations on how we can improve these materials, please do write to us. Thank you. And now I give the floor to David.
Thank you very much, Wendy. Without further ado, Anna can introduce herself, and yes,
sorry.
You're up.
Okay. Hello, everyone. I am Anna Maria Petrica, Youth Ambassador for the European Code Against Cancer for Romania and a young dermatologist. I am honored to present to you today the European Code Against Cancer, which is an initiative of the European Commission developed by the World Health Organization's International Agency for Research on Cancer. The aim of the code is to inform people about actions that they can take for themselves or close ones in order to reduce their risk of cancer. It consists of 12 evidence-based recommendations that anybody can follow without having a medical background or advanced skills or knowledge on the topic. It is estimated that with successful prevention, cancer burden could be reduced by as much as 50%. The code is, first of all, a preventive tool aimed to reduce the cancer burden by informing people on how to reduce or eliminate their exposure to carcinogens, and adopt healthy behaviors to reduce their cancer risk, and participate in organized intervention programs. But since successful prevention requires not only individual actions, but also governmental, the code is also meant to guide national health policies in cancer prevention. From all the recommendations, today we are going to focus on the 7th message of the code, which is avoid too much sun, especially for children, use sun protection, and do not use sunbeds. But before we delve into the topic, allow me to present the ECL Youth Ambassadors program, which is an initiative of ECL to help disseminate the code's messages within Europe through young health advocates. We are a team of youth with links to networks, associations, and societies who can disseminate the code locally or nationally. As of this year, we are a team of 65 youth ambassadors from 38 countries. We are serving our community through both joint actions, such as international campaigns, advocacy and research projects, art exhibitions, school competitions, but also through local and national activities, such as holding presentations and workshops, disseminating promotional materials at events and on social media, but also include other activities like marathons, hackathons, or even cancer screening campaigns. A few personal examples of promotion of the code are a waterfall social media challenge and a promotional video presenting the recommendations. These two were prepared for the World Cancer Day. But I've also posted other messages destined for various situations, for example, the COVID lockdown. Advocating sometimes meant reaching out to relevant stakeholders, such as the university or policymakers, to ask them to also contribute to cancer prevention in the way that they can. And last but not least, currently, I am working together with other wonderful colleagues from the team on exposing the challenges in cancer prevention, but also cancer care that we are now facing in Europe during the COVID situation. Thank you.
Thank you very much, Anna, for the brief but comprehensive introduction and for being such a proactive ambassadors. I'm now going to quickly take a second to introduce our first keynote speaker. Dr. Rüdiger is a biophysicist and is also the head of the Department of Molecular Cell Biology at the Elbe Hospitals in Lower Saxony, Germany. He's a member of several working groups of the German Commission on Radiological Protection, and he has also been working as an expert both at IARC WHO and at the European Commission, mainly dealing with skin cancer and health risks connected to natural and artificial UV radiation. He's also the Secretary General of EUROSKIN. So yeah, Rüdiger, the online floor is yours. Please go ahead.
Yeah, thank you very much, everybody, for joining the webinar, and thank you for having invited me. It's an important day, so we can share our recommendations and our projects for the future even further than we did that before. You will see from my talk there are quite a lot of redundancies between the talks you have presented and will present and mine, but this shows on the other hand that at least now we are speaking more or less with the same language, that I always find very, very important if many societies are coming together. I first like to introduce to you a bit the aims of EUROSKIN. So we are a not-profit-making society whose principal aims are the reduction and mortality of skin cancer. And we try that to promote and collaborate in Europe with several professionals and organizations, mainly in the field of primary and secondary prevention. Maybe this will open a bit to tertiary prevention in the future, which means therapy, because there is also quite a lot of to do because of the new medicamentations which are invented in the moment throughout the world. But this is something for the future. We are working together with Brigitte Bonen, who is from Belgium, and she is our president in the moment. We heard already that I'm the Secretary General of EUROSKIN from Germany, and Dr. Beate Volker is our treasurer in the moment, and we are still looking for a president to elect for the future. And I'm open to any recommendations and suggestions by you that we fill in this position in the near future. Next one, please. So what we are doing in principle is primary prevention by promotion of scientific studies and relevant to primary prevention, development and promotion and evaluation of effective information, promotion and development of solar UVR monitoring programs, which works in principle very, very good in Germany already, promotion of harmonization of information programs throughout Europe, and promote behavioral and environmental prevention. And the last word is very important in the moment because we and others opened very much to environmental prevention because we learned that giving advice for changing the behavior, then you should also present an environment which makes it able for you to change your behavior. To have a rule to seek shade at noontime, you see, means that you also have to have shade at noon at the places where you are living. And that's very important that we work in both fields. Secondary prevention, also development, promotion, and evaluation of effective strategies for secondary prevention of skin cancer, promoting population-based skin cancer registration, which we find very, very important to get all the epidemiological results together, harmonizing and classification of other activities essential to evaluation of secondary prevention, a harmonized approach to application of guidelines. So we have a huge F3 guideline in Germany now, which has really put together along to international standards. And we hope that this might influence also other countries to work along this guideline, which is dealing with primary and secondary prevention of skin cancer. And as you might know, we are very much promoting skin cancer screening, but this is still a debate in the scientific community, and this has to be found out in the future where we go in this field. And this has put together some years ago, you see in the skin cancer prevention book, which we edited, and quite a lot of this problems and possible solutions you can also already find in this book. Okay, can we go to the next one, please? So whom are we collaborating with? Which this is the WHO, it is the Association of European Cancer Leagues, it's ECAC, it's national and international boards of radiological protection, governments, we work together with the European Union and surely with others. Okay, next one, please. We had a very close collaboration with ECAC, you see, when we worked on the code of practice, and we heard that already in the talk before. And very important for us was, please, next one, point number 7 in this 12-point agenda, which you find a bit bigger now on the next, please. So this is the very important message we put out there: avoid too much sun, especially in childhood or for children. Use sun protection and do not use sunbeds. And especially the last recommendation, not to use sunbeds, really introduced some rumor in the society, because this was really kind of a penalty for the sunbed industry to fight against these recommendations. But we are very, very sure in the moment that this is the right recommendation because of all the damage we know which can be introduced by UV from sunbeds. Next one, please. So how do we understand skin cancer in the moment? And I apologize for this. This is the German slide, but you easily can see what we mean. So we know now that UV radiation from the sun, but also from artificial sources like sunbeds, is the main risk factor for inducing skin cancer. Fortunately enough, UVC radiation does not reach the surface of Earth because of an intact ozone layer. UVB and UVA then penetrate into the skin to different kinds of deepness and then can exert their harmful effects on cellular types of cells which you find in the skin. Next one, please. And what you can see here is a bit other representation of that. You see the skin surface and different cells which are also localized in the skin. So very prominently the melanocytes, which are giving rise then to melanoma, but there are also mast cells, fibroblasts. And what we found out in the last years is the very important compartment, which is called the dermal stem cells, which we know now will go up into from the dermis to the epidermis and differentiate into the melanocytes, which means that especially UVA, which you can see on the right side, can very deeply penetrate into the dermis of the human skin, might be able already to damage those dermal stem cells, which give then rise possibly to already transformed melanocytes, which are then sitting in the basal layer of the human skin and are just waiting for more UV to really be mutated. Next one, please. So this is what we know in principle about what the UV is doing. Also, I have to apologize for some German wordings. You see, so there is a direct effect on the DNA molecule by UVB. But UVA has also its effect because it interacts with photosensitizing molecules in the cell, which give rise to more or less reactive oxygen species, which then can break or damage the DNA. And you see by the direct mechanisms, we know that we induce certain dimers, which are premutagenic lesions, which are really characteristic for UV radiation. And by UVA, we more introduce strand breaks or other damages in the DNA molecule, which is the main target in the cell, which is damaged by UV. And as Ayak said, UV is a full carcinogen because it not only initiates, but it also promotes skin cancer. And UVA and UVB cause, for example, immunosuppression, which promotes the development of skin cancer because the immune system is then not able to early fight stages of cancer cells. And that's the double-sworded the double-edged sword which UV is playing. You see that it not only induces skin cancer, but also promotes it mainly by immunosuppression. Next one, please. And this is just to show you, this is a fluorescent slide, which is showing on the left side an undamaged skin of a human volunteer. And then we irradiate these volunteers with a certain dose, this IMED, which is roughly about the dose which you need to get a sunburn. And if you wait a few days, you see already the damage, which is here shown by the very, very bright green-yellow spots in the cells, is already diminishing. But if we look after 6 weeks, most of the damage has gone, but there are still some cells in the basal layer of the epidermis, and these are the so-called epidermal stem cells in the moment, which might be the most prominent cells which give rise to skin cancer induction. Next one, please. So what is the outcome then? You see, if you look for the risk factors and if you look for the risk factor UV, and this is done for melanoma by our colleague Sarah Gandini already quite a lot of years ago, but still valid because that has been very, very exciting epidemiological studies. So you see the relative risk, and then you see that the total sun exposure is going along with a certain risk. Chronic sun exposure has a lower risk, if at all. In the midterm sun exposure, it might be responsible for melanoma induction, is already higher, and sunburns already have a relative risk of 2.03. But then very important is the number of nevi, you see, which you induce by UV radiation, and the more you have then on the body, the more this is a sign for a systematic change in your body response to UV. And you see, if you go up to 100 to 120 of this benign nevi on the whole body surface, then you increase your risk later to suffer from a melanoma in your life. It's nearly around 7, and this is really a factor. Next one, please. So sunbathed UV is a very potent inducer of mutations. That's what we know. In a 15-minute sunbed session, reaching a minimal erythemal dose equivalent to some 300 joule per meter square, which is a sunburn-inducing dose for a skin type 2, already produces 10,000 to 100,000 premutagenic DNA lesions in every exposed skin cell. And you see how potential the damaging or how heavy the damaging potential of UV radiation really is. Next one. And if we look for the mutations, this was a very important paper published in Nature 10 years ago, which was really showing, because this was one of the first genomes which have been sampled for all the DNA bases, you see, and you see, if you go please for the next, you induce a total number of mutatic somatic mutation, which is nearly 34,000, and the signature mutations, which are the long barrow, which you see here, these are the so-called signature mutations, and of this roughly 34,000 mutations, you find that, next one please, already 23,500 are these signature mutations where you are to 99% sure that these mutations are induced by UV radiation. And this is the first metastasis which has been sequenced, and this gave very, very important insight into the mechanisms how skin cancer is really induced by UV. Next one, please. And just as a little overview, you see these are the GloboCan data for male and female about the age-standardized incidences of melanoma in Europe. And you see the heavy blue or the heavy violet areas in Northern and Western Europe. We do not know very much about the incidences in all the countries lying more in the east, because registration is just in some of these countries starting, and we are looking really for the future that we get more info from these countries. And next one, please. If you look for the age-standardized incidence rates of melanoma, then you see surely Australia and New Zealand are on the top, but then you see Western Northern Europe are following very soon with high incidences already for males and from females for the age-standardized incidence rates of melanoma. Next one, please. And if you look for the whole number of skin cancers, which is the sum of malignant melanoma, squamous cell carcinoma, and basal cell carcinoma, then you see that again Australia and New Zealand are highly on the top. You see with high incidence rates per 100,000 people in their countries, but this is then followed again from Northern America, but then Western Europe and Northern Europe are following very soon. So this is introducing an image of the burden of skin cancer, which we really have throughout the world. Next one, please. And this is another kind of representation which has been done for the BCLC and the SCC for basal cell carcinoma and squamous cell carcinoma. And you see here on this semi-logarithmic plots where the incidence is plotted against the yearly incident erythemal dose, that you really have an increase in straight lines, which is here already differentiated to the different age groups. And if you look to the bottom of the slide, you see that with an increase of 1 kilojoule per meter square of yearly UV dose, you have an increase of 67% in the number of BCCs, and already and even an increase of 95% of SCCs if you have an increase in this dose. This again shows how the UV dose is then giving rise to the induction of the different skin cancers. And I get this has been important light, which is done by our New Zealand colleagues, mainly under the head of Robin Lucas in New Zealand. Next one, please. And this again, I apologize for the German. These are the skin cancer incidences in Germany, but you can easily see where the numbers are. You see the malignant melanoma in Germany for the year 2015, which has been calculated in 2017. We had an incidence of about 36,000 melanoma alone. Basal cell carcinoma is 156,000. Squamous cell carcinoma is around 98,000. And alone in Germany, you have a total number of incident skin cancer cases, BCC, SCC, and malignant melanoma together of around 291,000. So this again shows that we have a real burden which we have to deal with and which we have to fight to get not in bigger problems as we already are. Next one, please. And this is when we already said that we are also looking for the occupational UV exposure, which is becoming more and more. And this slide shows you just, this is the overall UV. You see, this is the recreational UV, and you see this is a curve for the BCC incidence only by occupational UV. And you can see this reaches here the border of an odds ratio of 2. And this is important for many legal and international legislations, because then the legislation really has to care about this kind of disease, because a doubling is always seen as something which really has to be looked for. Where are the reasons and how can we fight them? And therefore, these authors in a very, very big study in Germany really came to the conclusion that occupational UV exposure is a major risk of basal cell carcinoma, and therefore this should be have in mind by all those people which are dealing with skin cancer. Next one, please. Okay, shortly, just these are the kinds of skin cancers which can be introduced. This is basal cell carcinoma. This is the most frequent with a low mortality. Then you have squamous cell carcinoma, the second frequent, which an increasing mortality in the moment. All the papers in the literature is showing that there is apparently an increase in mortality of squamous cell carcinoma. Maybe a simple solution because we are looking better than before, but this has to be clarified in the future. And then we have the malignant melanoma, which really can look very, very different, but this is a classical example with the highest rate of mortality, 20 to 25 people dying when they are diagnosed with malignant melanoma. Next one, please. And I said we work quite a lot on sunbed regulation, and EUROSKIN was very much involved in an opinion of the Scientific Committee on Health, Environmental and Emerging Risk of the European Commission, which is, as the acronym, SHEER. And we have been asked at an expert gremium to give an opinion on biological effects of ultraviolet radiation relevant to health, with particular reference to sunbeds for cosmetic purposes. And we really worked 2 to 3 years on this paper, and together with the European Code Against Cancer, I guess this paper has quite a lot, quite a huge impact on what is going on in Europe now, and what our beliefs in the recommendations we have to give with sunbeds. Next one, please. You can see this is just a short summary of this more than 100 paper, huge paper. And we were saying UVR, including UVR emitted by sunbed, is a complete carcinogen, as it acts both as the initiation and promotion. Sunbeds causes cutaneous malignant melanoma and squamous cell carcinoma at all ages. And very important was the wording: the beneficial effects of sunbed use, such as generation of vitamin D, are outweighed by the adverse effects. So that was very important to say at that time. And maybe even more important, there is no threshold level of UV irradiance or UV dose for the induction of skin cancer. So skin cancer is a stochastic process, and therefore there is no safe limit where you can say below this dose or below this irradiance, you are on the safe side. And we used this very strict wording really to show at that time, together then with the code of European Code Against Cancer, that there is really no need for sunbed use in Europe and throughout the world. Next one, please. And that will be shown, I guess, by Emily. Later on, you see these fact sheets of WHO, where you have the numbers nicely put together. You see 10,000 melanoma cases and 415,000 melanoma cases every year. You see by sunbed use, the younger you start using a sunbed, the higher the risk. Very important information if you start before age of 35 to regularly use sunbeds. And regularly means once the month, you increase your risk for a malignant melanoma later in life already by 60%. And this is even worse for squamous cell carcinoma and nearly as worse for basal cell carcinoma. And there are other injuries which you have to have in mind, and then we can together react on that. So we have been thinking about a ban of sunbed use, and I personally have to say that would be my solution, but this is very difficult politically to to get through, but you can look then for a restriction or a management. You see a licensing of training establishment, restrict exposure, and so on and so on. And we did that in the past, and we are always working on that together with information on the risk, with display warnings, and with ban promotion of the sunbeds to influence the politics throughout Europe to have the right health recommendations for the public. Next one, please. And this is already my last one. We wanted to discuss that in more detail with you on the 5th International UV and Skin Cancer Prevention Conference, which has been organized by the European Society of Skin Cancer Prevention, together with ECL and WHO and the Bundesamt für Strahlenschutz in Germany, you see. But due to the facts which you all know, we had to postpone this conference to the 20th to 23rd of April next year, and we could not stay with the date which we had just a couple of weeks ago in May. And therefore, I would like to close my presentation and just say thank you from the beautiful city of Hamburg, and thank you for your attention. And thanks once more to giving me the opportunity to speak here.
Excellent. Thank you very much, Dr. Greinert, for telling us a bit more about EUROSKIN and the great work that you guys do, and as well as giving us an overview of the etiology of skin cancers, summarizing briefly this SHE report, and also how to best manage sunbeds. And with this, I think we can take some questions from the audience. For Dr. Greinert, please do write them into the chat box. My colleague David will be the moderator and facilitator for the Q&A.
Yes, thank you, Ginevra. There are no chats at the moment in there, so just take a few minutes to think about. We have 5 minutes or so to discuss it. But I have a first question for Rüdiger. You mentioned a little bit about the screening and potential, and we've talked also about prevention, very much in the context of the European Code Against Cancer. It's clear messages there about sun and UV protection. But thinking a bit on the early detection side of things, I'd just be interested to know a little bit more about the progression of the various types of skin cancer, especially melanoma. Is this a slow growing or a fast growing cancer? And because this will influence what we can do in regards to timely detection to be able to lead to a better outcome for the person.
If you really look for the epidemiological data throughout Europe and throughout the world, and their IAC put the numbers together a couple of years ago, and GloboCan is still doing this continuously. So it's still a quite fast-growing cancer, you see. It's not as fast melanoma. It's not as fast-growing as BCC and SCC, but we are far away to reaching a normalizing level in many countries throughout Europe and the world. So therefore, the message is, even if it would stay at a high level as it is in some countries at the moment, we really have to do something against it, because especially for melanoma, although we have this very promising therapies now with all this immunotherapy and things like that, I think it's really the high rate of mortality which is giving rise to the fact that we still have something to do in the next year to fight the melanoma incidence, especially when we are thinking about the sunbed use, because there should really be very clear messages. There is really no need to use a sunbed to increase anything, you see. So the only thing you increase by a sunbed use is your risk for malignant melanoma and other skin cancers.
David, if you don't see any questions yet, can I ask Rüdiger something?
Certainly.
Yeah, maybe this is also for Emily as well, because now because of COVID and because of all the misinformation just going around, the fake news, people are, I heard that people are, tanning themselves because they think that the UV rays will kill the virus. So I can't remember which country that they started reporting a lot of people going out in the sun and actually kind of, almost burning themselves, because they believe that by burning themselves, they'll be able to kill the COVID virus. What do you know about this, and how can we combat this kind of fake news and misinformation.
I really guess, and WHO and other associations and institutions already react on that. You see, this is really the wrongest recommendation you can give. Surely UV radiation can kill the virus. You see, we use in the laboratory, we use 254 nanometer UVC to sterilize, you see, and to kill viruses. And I'm not so sure whether the other UV wavelengths are as important, but if you expose yourself to kill the virus, you see, in the sun or in the sunbed, you're just increasing your risk of skin cancer. I guess this is really a wrong recommendation, and it should really, we should really fight on that this is not going into the literature and other commissions, because this is wrong and induces a bigger risk than we already have in the moment.
Yeah, great. If we have no other questions, we can proceed so that we're on time. So thank you very much, Dr. Greinert, for taking a couple of questions from the audience. And Emily, whilst you start setting up your screen, I can just introduce yourself. So our second keynote speaker is Dr. Emilie van Deventer. As I mentioned before, she's the head of Radiation and Health Unit at the WHO Geneva, where she leads a program covering the public health aspects of ionizing and non-ionizing radiation safety, and provides information and guidance to national authorities on radiation protection and health. She is also responsible, amongst other things, for the WHO International EMF project, the Global UV project, and radon activities. Before joining WHO, Dr. Van Deventer was a chair professor of electrical and computer engineering at the University of Toronto in Canada, and she holds a PhD from the University of Michigan, USA, and also received the honorary doctorate from the University of San Marcos in Lima in 2014. Please, Dr. Van Deventer, go ahead and you can share your screen.
Can you hear me?
Yes. Perfect.
And can you see my screen?
Yeah.
Excellent. Great. Well, thank you for the opportunity to talk to you today. What I'm showing you on the screen right now is a scenery in Nice in southern France. And you can see on this picture that even though the weather is not too nice, it's not very sunny, people seem very happy to be on the beach. The reason why is because this picture was taken 9 days ago, and that was when that part of the country was coming out of lockdown because of the coronavirus. And the policy had been that the beaches were closed, and then they actually just opened the beaches for people to swim, but not to sunbathe. So you can see here the silver lining for sun protection out of this difficult crisis that we have been living through. So what I wanted to discuss with you this afternoon for a short time is the recommendation 7 of the European Code Against Cancer, that is to avoid too much sun, especially for children, to use sun protection and not to use sunbeds. I guess this is the wording in the European Code Against Cancer. And just a couple of words for the organization that I represent, which is the World Health Organization. This is the organization within the United Nations system that deals with health and public health. And right now we are extremely involved and busy with the response to the COVID-19 situation. As you can see here, the way we define health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. Being a United Nations agency means that we are very much working towards the Sustainable Development Goals. There are 17 of them. And I'm not sure that everybody is aware of these goals or knowledgeable about them. These goals have been developed by the United Nations, and they have been endorsed by every member state that is part of the UN. And so all the countries that you live in would have signed up a charter to work towards the achievement of these goals by 2030. From a health perspective, the one that is of interest to us is goal number 3, about ensuring good health and well-being for all ages. And when we talk about cancer, the target that is within those SDG is the target number 3.4, to reduce by 1/3 premature death from non-communicable diseases, including cancer. So WHO is working very much towards that goal and looking at all the risk factors that, that could promote cancer. And from an environmental health perspective, what we are interested in is, of course, to look at the evidence for the risks to health from a certain agent, in this case, ultraviolet radiation. Also to promote useful policies, regulations with respect to these risk factors, and also to encourage discussion, communications, education campaigns of the public on this topic. So we come to this area through the radiation program at the World Health Organization. So in the radiation programs, we look at electromagnetic fields and their health effects, at optical radiation, including ultraviolet radiation, as well as ionizing radiation. So today I will concentrate on UV radiation, but we really have a program that looks at all these different types of radiations. And so when you look at the public health impact of radiation, you will see that UV is actually high up on this agenda, being the main leading cause of skin cancer, followed by radon, this radioactive gas that you may have in your homes, depending on your country and your topology and geology. And then maybe the use of ionizing radiation in the medical sector through X-rays and so on. And at the bottom there are electromagnetic fields. And the type of questions that we ask is, what is the global burden of disease from these different types of radiation? What interventions would be the most effective from a radiation protection point of view, and what is the cost to the health system? These are some of the questions that we are trying to answer. So from a global perspective, not just thinking about Europe, but more globally, you have heard about melanoma projections and trends already from Dr. Greinert, but this is a graph showing as a function of time and predictions over time of melanoma for different countries. So the top one, the blue one, is Australia. The red one in the middle is USA, and the bottom one in green is the United Kingdom, none of which are in the European Union. And what you see is, depending on the country, the trend is slightly different. And you can see that Australia here has had a very big incidence of melanoma, but they have also worked extremely hard because of that through different types of policies that they have implemented for now several decades. And this is starting to pay off, as you can see, with this decreasing trend over time. And this slide shows you the number of cancer cases in 2012 among both women and men. And you can see that on the first spot is for Europe, with over 80,000 attributable cases, followed by North America, Oceania, South America, Africa, and finally Asia. So this topic in Europe is of relevance, and this is why it is being discussed today. The basic protection measures that have been for many years promoted are really based on individual measures that one can take, actions to take and actions to avoid the sun. So first of all, limiting the exposure, especially during the midday hours when the sun is at its highest and strongest. Also try to seek shade as much as possible, wear protective clothing, wear a hat, put sunglasses on for your eyes, apply sunscreen, avoid tanning beds, and very important, protect young children from the sun. So these you may have seen and heard quite often, and there is a tool that has been developed over 20 years ago now by several United Nations organizations, including the World Meteorological Organization, the United Environmental Program at the UN, and the World Health Organization, called the UV Index tool. And this tool is mostly a communication tool that is used and proposed and promoted through meteorological organizations at the country level to give guidance to the public. And when the UV index is 3 or above, we require that protection, we recommend that protection be taken. For a UV of less than 3, we don't expect that a protection is needed. But as you can see on this graph, that even for very low levels of UV, you can have damage to the skin. And this is what Dr. Greinert just mentioned. There is no threshold below which UV is not dangerous from a skin cancer perspective. It just depends on how long you are sitting in the sun or being outdoors without protection. And you can see here, this is a map of the world and the index levels of UV in the summer months. And you can see for most of the world, actually, the UV peak is higher than 10 in all these regions. I guess in a way, Europe is lucky to be higher up in latitude. Now, I have mentioned a number of different measures for protection, but what is the evidence for effectiveness of these measures? And there we can see that there's been quite a number of efforts done at the national level and international level over the years. These are examples from different countries who have put up education campaigns from Ireland, from the US, from Denmark, showing how to incorporate this type of protection measures. But really, as mentioned earlier, one of the countries that has been at the forefront of sun protection has been Australia. And so over the next few slides, I will show you a few of the examples of tools that they have used. So first of all, this is a picture taken several decades ago when at the time sun tanning was still seen as a very good and nice things to have, but they have moved along quite a bit since then. And you will see that in Australia, there has been a major push to educate young children to be sun smart. And in the schools, the children are not allowed to go to school if they don't have a hat on, and the settings of the schools include more and more shading, so that the children can play at break time in the outdoors. And you can see that this is not only in the school, but also in swimming pools and so on. And this is, these go beyond the individual level type of measure. It goes into the local authorities or the school authorities to handle. Now, they have moved in terms of role modeling from the guy on the beach with a small swimming suit to people with a hat, with the sunglasses and full top clothing. And they have done a lot of TV campaigns over the years, put a lot of energy and funding into promoting such campaigns. And a few years ago, we had a conference in Denmark, and the Princess of Denmark, who is actually originally from Australia, was singing to us the songs Slip, Slap, Slop, because this is very much ingrained in the psyche of the young people in Australia now. But just campaigns is not enough. And what Australia has done also is to support all this through different types of policies. So, for example, provide a sunscreen. They very much push for a sunscreen with a protection factor over 30, and they use this, they sell this with tax-free, as a tax-free implement. Now, also the sun protection items are tax deductible for outdoor workers. And they have a number of laws enshrined in their occupational health and safety laws and in common law with regard to sun protection. You may also be aware that Australia is the second country in the world after Brazil that has banned totally the commercial sunbeds. And in Australia, it's been banned since 2015, while in Brazil since 2009. So using different types of tools to actually enhance sun protection. So what is effective? This is an important question, and over the years, what we have seen is a number of examples from many countries. Here you see an example from 2002, the early 2000s, from the US, the Center for Disease Control, from Canada, from the UK, and again the UK, New South Wales, the Victoria in Australia, Ireland, US, again the Surgeon General's advice from the United States, another from Ireland, and the latest one that I know of is a new cancer strategy that was just developed last year in 2019 in Norway. So you can see that although we think that sun protection is very mature, it actually is in very few countries that you have a strategy. I'm showing you here half a dozen countries, and we have 194 member states. So there is a lot of work yet to be done, even at the European level, to tackle this problem. And the CDC a few years ago had a task force looking at different types of interventions and looking at their effectiveness, and they have rated different interventions, recommending some of them and recommending against some others. But you can see here that, for example, educations and interventions with children in mind and community-wide interventions are very much in the front line. What we saw out of the Australian and US experience is that really you don't have just one positive tool to use, but it's really a multi-component intervention that has to be taken, including to use the media and to be able to have funding to invest in campaigns on an annual basis, because doing one campaign at one point in time is not going to be very useful. What is also very important is to be able to have research and evaluation performed. And so it is really a multi-component intervention that needs to be applied at the national level. In terms of the economics of skin cancer prevention, several countries have studied the topic and calculated how much it costs to actually treat the cancer, how much it costs to the health system of the country, and how much does it cost to have primary prevention. And in Australia, for example, where a lot of this research has been done, they saw that skin cancer prevention campaigns had a return of investment of nearly 4-to-1. That means with $3.85 spent, you could gain that back for each $1 invested. So it is felt, at least from that example, that it is a very good investment to do primary prevention when we talk about skin cancer and UV. So I would like to finish my presentation by just mentioning the topic of sunbeds. Dr. Greinert just mentioned this in his presentation, and he mentioned this European Commission opinion that was published in November 2016. And to summarize maybe what he said in one graph, you can just choose here the type of cancer that you want when you go and lie down in this tanning bed. I think it's as simple as this. Now, in terms of the policies or the interventions that have been taken by different countries, it goes from a ban. I just mentioned Brazil and Australia that have banned completely sunbeds, to a large panoply of other interventions that have been taken by a number of countries. That is, for example, restricting the use of the sunbeds by age group, for example, less than 18 or less than 14, like in the US, prohibiting unsupervised access, restricting the use based on your skin type. There's other types of interventions that relate to educating, training the people who work in such establishment, restricting the exposure, that is the type of lamps, and the strength of the lamp in the sunbed. For example, requiring eye protection. Some countries like the US have put a tax on the use of on sunbeds. And of course, promoting information provision to the customers. So these are a large number of interventions, and there again, quite a bit of work has been done to try to figure out the cost of these different interventions versus the cost of banning. And so far, a ban would be very cost effective from a public health perspective and from a cost effectiveness for the health system in the country. Now, to summarize my presentation, in terms of the trends that we see, the human and the financial burden of skin cancer, we think is only going to get worse, mostly because skin cancer rates increase as the population ages. And as we know, the population around the world is aging quite fast. And the behavior that we see in many countries, and I see that in Europe, even though we've had campaigns in Europe for quite a number of years, the behavior doesn't necessarily improve very much. For this to improve, you need to invest over the long term in these multi-component campaigns, and to have a budget that is provided by the nation to handle such campaigns. There are a number of policies that can be taken for different subpopulation, for example, for the workers, for children, and these are very important and useful. And finally, I wanted to bring about the topic that was just discussed prior to my presentation, which is the fact that we don't promote sunbathing unless you are an umbrella and you have sunscreen and all these other implements. And in the case of COVID-19, as was just mentioned, there were some wrong information going around, and that's why we have developed this what we call myth buster, that you can catch COVID no matter how sunny or hot the weather is, and do not expose yourself to the sun because on the pretext or in the hope of killing the virus. So this is a very important point that was brought up. And as we see the summer coming and the lockdowns coming out of effect, please do not forget that it's important to protect yourself from the sun. Thank you very much.
Brilliant. Thank you so much, Dr. Van Deventer, for the clear introduction to UV radiation, the UV index, but also for running us through different types of best practices in skin cancer prevention, as well as the intervention and policy responses that have been done so far. I'm quite conscious of the time, but I will open the online floor again through the chat box for maybe a couple of minutes if there are any questions for Dr. Van Deventer.
There are no questions in the chat at the moment, so maybe we can go to the poll if there's some.
Great. So it's now time for an interactive quiz. The quiz will appear on your screen in just a second. Just please ensure that your Zoom window is maximized and that your pop-ups are allowed in your settings. And as soon as the quiz gets on your screen, our Youth Ambassador Anna will read out the questions for you, and you will have some time to answer the questions. So the poll has now been launched. So Anna, your floor is yours.
Thank you, Gina. These questions are for you to check your knowledge. You will only have one correct answer for each, and I believe you will receive the correct answers later through email. So the first question would be, which of the following sentences is true about skin cancers? Second one, what is the safe time limit for UV radiation from sunbeds? Third question, what policy measures can reduce health risks posed by sunbeds? Fourth question, then again, which one of the following statements is false, basically about UV radiation? I hope I'm not going too fast. The fifth question would be like a practical problem. So you applied Sanskrit at 12 p.m. for an afternoon of reading on your terrace. So now it's 2 p.m. And which one of the following actions would best protect your skin? And as to deepen your knowledge, which factors are influencing the strength of UV radiation on the Earth's surface?
Great. I'm seeing about half of the people on the line that are replying. So I'm just going to wait a little bit more to give you the time to go through all the questions. And so far, it looks like you guys are getting them right. So I'm happy that you were able to follow the presentations. I think there's about 5 people left if you guys want to give it a try. Great. I think about 85% of you guys managed to reply to the quiz. So I'm just going to end the poll. And thanks for the responses. We will share the result of the quiz and the correct answers in the thank you email, along with the presentation and the recording. And just before I sign off, I will let my colleague David Rishi close the webinars with some final remarks. And from my side, thanks very much for tuning in live. It was great to have over 40 of you on the line today. And I also would like to warmly thank our keynote speakers for taking time off their busy schedules, especially during these current times, to be here with us. So thank you very much to everyone who was involved in the organization of the webinar, and to you guys for tuning in live.
Yes, thank you, Ginevra. Thank you also for the organization and coordination of the webinar, and also to Rüdiger and Emily for the excellent presentations. I think we got some very important and clear, precise, helpful information there, starting with Rüdiger telling us about the relationship between UV and skin cancer development, and how we're seeing the burden across Europe and also more globally. And important to note, with the rising age of the population, we're also unfortunately going to see a rise in skin cancer over the future. So this is an issue that we are going to have to live with for many years yet to come. But I think some notable points that I picked up as well were regarding the data, how in some parts, for example, in Europe, some countries, it's difficult to have accurate data in regards to the availability of the registries and so on. within those parts of Europe. So that's something perhaps we need to think about and advocate for in terms of information that's available to be able to track this projected rise. And we also heard about effective actions in regards to the prevention and timely detection of skin cancer and how a comprehensive approach is really necessary. So whilst we saw great examples in primary prevention, health promotion, especially based at the school setting, there also needs to be more comprehensive, joined up strategic thinking to be able to bring in other instruments, whether it's in fiscal policies in regards to making sure that some protection isn't unaffordable for a large number of the population. And then also crucially, the continual issue that we're battling against in terms of the availability and marketing of artificial tanning devices and sunbeds, and how this requires really a comprehensive strategic strategy at the national level and ideally more internationally. But as was mentioned, there are not so many great examples yet at the moment. So this is also an area we should be advocating for in terms of more comprehensive national plans there. And then thinking in terms of the cost effectiveness of this of skin cancer prevention, we see also that we have this great intelligence and information available about the return on investment, because this is really argument and knowledge that helps open doors and convince people to support us in our goal to reduce skin cancer incidence and improve survival and so on. If we can show with this kind of information that it does have this positive return on investment, this is really essential knowledge to also use and communicate widely. And then finally, just to remind you all that the EUROSKIN conference is postponed to next year. So mark your calendar for the 20th to the 23rd of April, 2021 in Mechelen in Belgium. So we can go deeper, building on this information we've had today, explore further our tactics in terms of primary prevention, secondary prevention, regulatory areas and so on, and also regards to research and other aspects. So the EUROSKIN conference is a great landmark, a milestone for us to aim towards in regards to this topic. So thank you once again for your time. The slides will be distributed, I believe, after the end of the webinar, also to the people who couldn't attend, who signed up but didn't attend. So there'll be opportunity to follow up on the information we've had, and then meet again at EUROSKIN next April.